I wish people would relax. I mean, it is a very safe time in our lives in medicine to proceed with elective surgery, and we do things very safely. And we're going to explain everything we're going to do, and you'll go back, and it's a very comfortable experience. You'll just kind of drift off, and the next thing you remember will probably be an hour after the surgery. I mean, you won't remember the operating room, and you won't remember even the first hour in recovery. Welcome to Plasticos, the everything you ever wanted to know plastic surgery podcast with me, Dr. Christopher Park, and host Kym Anderson. We will discuss surgical and non-surgical plastic surgery options and the ways that they improve your health, mood, personality, and success.
Hi, and welcome to Plasticos, the podcast where we answer all your questions you may have about plastic surgery. I'm Kym Anderson, along with Dr. Christopher Park, board-certified plastic surgeon here in Mobile, Alabama. Now let's talk about how people need to prepare themselves for plastic surgery. We've talked about the procedures, but when you decide, okay, I'm going to have surgery, what do you need to do?
That's a great question because, it's one of those things that every single person needs to know, and it's nice to have an opportunity to kind of expand on those things a little bit. So there's the basic things of being just in general as happy and healthy as you can be. We don't like smoking with any surgery, and so there's certain surgeries we won't do with smoking. But, leading up to surgery, we want to make sure you're well nourished. You can go so far as to see a nutritionist, but in general, we got to make sure you're getting enough protein. And I like multivitamin, vitamin C, and zinc sulfate orally. They're just over the counter. So a daily multivitamin. I prefer vitamin C, 500 milligrams twice a day, and zinc sulfate, 220 milligrams once a day. For about a month leading up to surgery is just going to help you heal better. Protein can be supplements. There's plenty of shakes out there like Boost Shakes and Ensure, or you can get powders like Juven and just add them to water or food. It's not required, but it's going to help you heal better. Of course, if you have medical issues, we want those as well controlled as possible. Smoking, we talked about diabetes. I mean, if you have diabetes, obviously it can be treated. We need to make sure you're treated well. We like your sugars running below 150. There's a nice test now that we have called hemoglobin A1C, which kind of shows what your sugars have been for the last week to month. And we like that number at least less than 6.5. And the lower, the better. It means that you're controlling your blood sugar well. When your blood sugar is high, obviously that's a whole nother topic, but everything just doesn't work as well.
Yeah.
And that sugar, the glycosylated proteins don't work for healing. We're not talking about the long-term issues. We do like you to start a laxative or a stool softener before surgery so that we're not dealing with constipation afterwards. And again, all this is over the counter, so you're not going to get a prescription from me. It's not like, I know my doctor told me to take this, because you don't need a prescription. But we do like people to go get it. We have it written down and we try to tell them, but not everybody sees it. So it's nice for them to hear my voice say that. Just a stool softener, there's no harm in taking it. Everybody's going to get anxious. Everybody's going to get nervous. And what we do, we, see each other several times before surgery. We're going to have a consultation. We're at least going to have a pre-op appointment, and I'm going to see you again the morning of surgery. So if there's anything you need to verbalize or ask, get it off your chest so you can relax and rest and heal better. Please do it at those circumstances. Now, it's very important to rest before surgery and sleep well. And then it's also very important to get things ready at home. And we do our best to educate patients, but it's nice to have some extra gauze at home and some extra sheets and some extra pillows and things that you might want after surgery. We also want to limit infection, and everybody always wants antibiotics, and we do use antibiotics when we need them, but the best way to prevent infection is good hygiene. Infections can happen. The main way infections happen with surgery is bacteria that are on the skin going inside when we do our work, and we do everything we can on our end.
Yeah.
And all of our instruments are, of course, sterile. Hands are sterile, and we clean the skin as much as possible, but we're dealing with the skin that walked in the door that day. And so we like patients to use antibacterial soap for several days or even a week or two before surgery. I really prefer Hibiclens, which is chlorhexidine gluconate. Again, it's over the counter, and you can use that. It's a little bit harsh. It's going to dry you out a little bit, but it's worth it for surgery. If somebody can't tolerate that, makes them too dry, even a dial type of antibacterial soap.
That's what I was about to ask you, because antibacterial soap breaks me out. So I'm sure there's other people that way.
Yeah, if you break out, then we've actually hurt ourselves, because if you're breaking out, then your skin is moist and you have more bacteria. Our skin always has bacteria on it. So it's just we're trying to minimize how many to reduce the risk of infection. Whenever somebody does get an infection, there are always these questions of why and how. It's very simple. The outside of our body is covered in bacteria, and we try to keep them out. So the more you can help us beforehand, the better.
What about exercise? Now, is it okay to even exercise beforehand? Maybe try to drop a little bit more weight before you go into surgery?
Absolutely. There's no reason to stop exercising, even until the day of surgery. That's great.
Okay, now we covered the preparation that needs to be done before you go into surgery. Now, the day of course, you're going in the morning. Are there certain things that we need to take into consideration then?
Yeah, some general things we like to tell people. You cannot eat within at least 8 hours of surgery. And we usually say just stop at midnight, and even if your surgery's in the afternoon. So that can be hard. You may want to distract yourself. You can eat the night before, and you can, if you take important medicine, we do like you to take your important medicines like blood pressure medicines, thyroid medicines, the day of surgery. So when we say nothing by mouth, yes, those medications are fine. If you ever have a question, ask us. But anything that's important with a small sip of water is safe. So you're going to come to surgery. We want you to wear comfortable clothes. We want you to bring anybody with you that you want with you. You're going to see me again. We're going to do some basic things, make sure labs are okay, and get an IV in. Usually, almost all the surgeries I do, we're going to have to stand you up and draw on you. And then once we do that, we can give you a little bit of sedation, but I can't have you stand up if you've been sedated. And then basically, you're going to meet the anesthesia personnel, and we're going to explain everything we're going to do, and you'll go back, and it's a very comfortable experience. You'll just kind of drift off, and the next thing you remember will probably be an hour after the surgery. I mean, you won't remember the operating room, and you won't remember even the first hour in recovery.
You have to have anesthesia because you're going to be put out when you go to the hospital, but some people are a little weary of that. I mean, what would you tell them?
Yeah, I mean, we've talked about it before in other podcasts. I mean, everybody gets nervous about that at some point, at least a little bit, and some people a lot. I wish people would relax. I mean, it is a very safe time in our lives in medicine to proceed with elective surgery, and we do things very safely. I mean, we have MD anesthesia involved, which means another physician is purely in charge of that. We have nurse anesthetists, we have me. That does not come into my mind that you're going to not wake up. You're going to be fine. And really, you're probably doing more harm than good working your body up, not sleeping the night before. People have to understand, I'm a physician, and when I meet you, the whole time I'm evaluating and deciding if we can do surgery, once I decide that you're a reasonable candidate for surgery, you need to kind of trust the system, and we're going to take care of you.
Don't give yourself unnecessary stress.
It doesn't help a thing.
Now, you mentioned the vitamins and the supplements that we want to take. What about diet, changing our diet as far as food? Do we need to take some that are a little healthier and more vitamins in them?
Yes. I mean, we won't get off on a tangent here, but there's a lot of things in our diet that are considered inflammatory. And there's a whole diet now based on reducing inflammation and how that can help with chronic conditions. And that carries over to surgery. And there's a lot of things that you could do there. I mean, fried foods and all sorts of things that are not good for you. But in general, without consulting with a dietitian and getting a long list, it's hard to kind of summarize it, except drink lots of water, eat protein, and take those vitamins. And as I've mentioned before, we have added infusion therapy to our office, and it's really nice to do that infusion therapy preoperatively and postoperatively and give you that bolus of vitamins that will help you heal.
So you need to come into your office to do that. That's not something that we can do in the hospital.
Correct. Those infusions that are full of vitamins, we order and get from a pharmacy, and we have them in our office, and we can do it at your pre-op. We always see people pre-op and go over consents and provide our prescriptions beforehand. I meant to mention that. So I like to give my patients their prescriptions in the office at their pre-op appointment several days before surgery, so you can then leave my office, go to the pharmacy, drop them off, pick them up, and then have that all done. Back in the day, we used to give you your prescription at the end of surgery, and your poor significant others driving you home, leaving you in the car, walking in the pharmacy. They're like, oh, it'll be ready in 45 minutes. So we try to make that very smooth and easy. But anyway, back to your question. At the preoperative appointment is a great time to get a bag of, and it's not just fluids. In the hospital, you're just going to get fluids.
Yes. All right. So going back to what you said about diet, would you recommend that we find a nutritionist before surgery?
Well, that's the cat's meow. I certainly don't require it, but I certainly love the patients that either are experts in their own diet or do visit with somebody. We don't require it, but it's a great thing to do.
And it could be life-changing, something that you want to keep doing
absolutely
forever. Now, what about the patient who has a surgery scheduled, but then all of a sudden that patient becomes ill? Do you still do the surgery?
No. I mean, we wouldn't do anything elective in that situation. It doesn't even matter if, it's Wednesday and your surgery's on Friday and I went to the urgent care and got some antibiotics. No, we don't want you ill at the time of this operation, especially if it's bacterial. When you get a bacterial infection, even if your symptoms are one place, like you have a pneumonia, those bacteria get in our bloodstream and circulate, and our immune system fights it, and then antibiotics help fight it, but they are circulating. And if you're putting in a breast implant at the same time, it could land on that breast implant and be a long-term problem. So no, we have a very low threshold to cancel or reschedule surgery if there's any illnesses or conditions.
And you can always reschedule.
Absolutely.
For somebody who is on a lot of medication or has several prescriptions that they need to take, do you coordinate with their general physician? How does that work?
Yes. I mean, every patient I see when I'm discussing surgery, I decide if I need assistance from a medical perspective. The two most common specialties would be your primary care doctor and then cardiologist. If somebody has a history of cardiac disease or stents or anything, then we like to have them see their cardiologist. Those people at that point in time should be getting stress tests every year or two and make sure that's current, because surgery is a stress. So we would rather do a stress test when everything's being monitored rather than a surgical stress, because that's what a stress test is. But yes, in terms of general medications, I can decide most things, but if it's complicated or we're not sure if it's a medication we can stop, then we coordinate directly with your primary care physician. A common one is blood thinners, and that's a big question, because nobody is on blood thinners that doesn't need to be on blood thinners. So we can't just stop them willy-nilly, and those are a lot of times the ones that we really have to get some coordination with. If somebody's just been told take aspirin once a day, just for good measure, then we can stop that, and we prefer to stop 2 weeks before surgery. But if somebody is on these for a specific reason or told by their cardiologist to take it because they've had X, Y, or Z, then that's a different situation, because we want to make sure we keep that patient safe. But the common blood thinners this day and age are aspirin is a real blood thinner. I mean, if it was invented today, it would be prescription. It's potent, but it's over the counter. Plavix, Coumadin, Xarelto, Eliquis. There's other ones, of course, but those are the most common ones. Those are real deal blood thinners that could make it where the surgery I'm doing is very difficult to stop the bleeding. And occasionally we have to do surgery on those medications if there are conditions such as a mechanical heart valve requires it. Now, what does that mean? That means if it's an elective surgery, I may not do it. I'm probably not going to do it.
And that was going to be my next question I was going to ask you.
But if it's something we have to do, which is still a big component of my practice, whether it be cancer or whatever else, we do coordinate those all the time and very frequently have to operate on patients with significant blood thinners.
So there have been times then that you've had to turn people down and say, no, we just can't operate on you.
Yes. If the risk outweighs the reward, we're not going to do it.
Not every doctor is going to be the same. Some of them may just want to do that, but that's what's important, to look for a board-certified physician.
Yes. I tell people all the time, I am a physician first, and a plastic surgeon second, and, a father and a husband after that. I mean, I'm a businessman way down on the low end of the spectrum. I mean, this is not about generating revenue. This is about taking care of people.
If people had questions about surgery and post and pre-surgery, how do they get in touch with your office and have questions?
Well, we can always see them as a normal patient, of course. So they can call the office, 251-340-6600 for a regular route. We also can be reached out to through our website. There's a couple ways to do that, but the easiest is info@mprsd.com. We're Mobile Plastic Reconstructive Surgery and Dermatology. And people still, I don't think, believe it, but I see and answer almost all of those emails myself. And we even have a virtual consultation on our website. You can upload your photos with a password-protected way to do it. And I look at them and I respond. I still require a hands-on evaluation to figure out what I really want to do. And I talk with my hands, and that changes everything. But it's very easy to get in touch with us.
All right. Thank you, Dr. Park.
Thank you. Thanks for listening to Plasticos Podcast. Please follow us on our Facebook page, and please rate and review Plasticos on iTunes and anywhere else you get your podcasts. This really helps others discover this show. Have a plastic surgery question you want us to talk about? Contact us on our Facebook page or email me at drpark@mprsd.com. That's drpark@mprsd.com. Plus, we really want to hear what you think about our episodes, so let us know. Thanks again for listening, and remember, insist on credentials, invest in results.